We're walking through what actually happens inside the brain when a stroke hits. It's not just a clot. We're talking about a cascade, a chain reaction that starts the moment blood flow drops below a critical level. Your brain doesn't store oxygen or glucose. It relies on constant delivery. So when that supply gets cut off, neurons start panicking. The first thing that goes? ATP. That's the energy currency your brain cells need to function. Without ATP, the sodium-potassium pumps fail. That leads to a flood of calcium and glutamate inside the cells. Think of it like the cell walls getting overwhelmed and letting in all the wrong guests. This sets off the ischemic cascade. Free radicals, lactic acid, and inflammatory chemicals start forming. Neurons swell. Some die off quickly. Others hover in a dangerous zone we call the penumbra. Not dead yet, but definitely not okay. Now, if you've never heard the word penumbra before, think of it like a gray area. The bullseye, the ischemic core, is already gone. But the surrounding ring? That's brain tissue we might still be able to save. If we act fast. That's what every stroke treatment is aiming for, preserving the penumbra. We want to restore blood flow before that tissue dies off too. Here's what makes this even more important. This whole cascade doesn't take days. It takes minutes to begin and hours to finish. And every hour that goes by untreated, the brain loses about 120 million neurons. That's why we say time is brain, because it's literally true. So whether you're at the bedside or calling the code stroke team, you need to move with purpose. Every delay means more damage. This is why we hustle to CT, why we screen for TPA, why we ask last known well, like it's the golden ticket. Because it is. When families ask, why are you rushing? This is your answer. Because this stroke is unfolding in real time, and I'm trying to save as much of your loved one's brain as I can. That's the ischemic cascade, and why the clock starts the second the symptoms do.